So listen, I'm here today to talk to you about safety consultation representation, and I suppose in the context of 45001 and the new standard and framework that has come into play, safety representation and consultation is a cornerstone or a keystone of that framework. And regardless of what safety management system we are using, or whether it's a basic safety statement, a construction stage plan, we need to make sure we have good active participation from all people. And when we're dealing with all people, we're talking people with different levels of education, different skills, different languages. And I suppose one of the main key elements of the Safety, Health and Welfare Work Act is to make sure that we can communicate effectively to all workers on a day-to-day basis. So my objectives for this morning, just going to talk about safety representation and consultation. I'm going to talk about the HSA action plan and some of the things we are going to be looking at in terms of construction inspections this year. Now, it's always good for the audience to know what we're going to be targeting and what we're going to be focusing on. And I will say health is going to be an up and coming and a bigger focus for the inspection campaign. I'm going to take the stage a little bit about BeSMART for construction. I say I'm a HSA inspector, but primarily I'm working with the TCB team, and we're involved in the development of BeSMART. And like 18001, 45001, this is a safety management system. It's a very basic safety management system, but it needs to be communicated, it needs to be consulted with the employees. So I think it sits in nicely, and we have consultation and safety reps and participation all covered within that document, along with the safety statements that we have. So where are we with construction in Ireland at the moment? There's some key facts here which are going to surprise a lot of people, because when I heard these facts at a conference a few weeks ago, I couldn't believe it. We have around 35,000 businesses, construction businesses in Ireland. 90% have less than 10 employees. The regulations, in particular construction regulations, state that you must have an elected safety rep on site where you have more than 20 people on site. Yet most sites potentially will have only about 10 employees. So there is a bit of an issue. How are we going to communicate and get talking to the workers out there and get them participating in an effective and safe and healthy construction site? And that is a big challenge for the industry, and we're going to have to look long and hard at how we adapt and look at this particular sector and the numbers involved in it. Another element, 46,000 construction workers are self-employed. If you're self-employed, you have to have a safety statement. You're your own boss. And the legislation says self-employed have to have a safety statement. So I think taking care of business, BeSMART within the authority will help that cohort of workers who now require safety documentation that they can do themselves. And again, making sure that the information is simple and easy to understand, NALA guidelines is so important. About 25,000 units in the housing for 2018, so that's going to be growing and increasing. And you're going to see a lot of those 10 employee companies or less working in that area. In terms of fatalities and serious accidents, what's happening? Last year we had 5 fatalities, 795 3-day reportable accidents, and so far to date in 2018 we have 3 fatalities and 237 3-day reportable accidents. I would like to remind people here, we think accidents have been seriously underreported, and we are not getting a good genuine figure of what is actually happening out there. Where the quarterly National Household Survey is throwing up figures which are a lot higher. And the average cost of an accident to business? That's why we need to manage safety. That's why we need to have 45001, safety cert, safety statements like BeSMART, the Code of Practice for 3LS. These will help identify, educate employers and employees as to what they need to do. And this message must be communicated effectively. When I went doing a little bit of research on the ILO website regarding 45001, that was one significant figure that came out, that 7,600 people die every day in work-related accidents. And that's over 2.78 million people. And health is going to be a big focus for ourselves. And it's something that's been, probably sitting back there a little bit, and you're going to see the authority looking at like silica, more on asbestos, noise and vibration. So it is a legal requirement to make sure you have a safety rep on site where you have more than 20 people on site. The cornerstone is set down in the Act. Section 25, safety reps. 26 is consultation. But key is the construction regulations. Regulation 23 outlines a lot of detail in terms of what is required, in terms of what the safety reps can do. As an inspector going on to site myself, I've always made an attempt to go and meet, and where possible, get the site safety rep to walk around the site during my inspection. It's nice to get another view, another perspective from the workers on site. You will get a management speak, but you'll also get a worker speak, and that's where the safety reps works very well as far as I'm concerned. What is the authority doing? We do a program of work every year, and we have planned actions and performance indicators, and that program of work is available for download from our website. So if you have any interest in seeing what our plan of action is for the year, go and download the document. Key element here, coming up in the green, continue to promote safety representation and employee engagement. And they are two key words: engagement of employees. We need to communicate and we need to talk to the employees. We also need to listen to them, because I found over the years they can bring the best solutions to the problem. And we also need to make sure that when we are writing information, that we write it in a language and we communicate it in a manner that they can understand. Because again, as I mentioned earlier on, we have different levels of education and learning that is out there on the construction site. So take time, listen, and put in plans of action. If you have a site with 10 employees, come together, be strong, talk to each other, communicate. Because if you don't, you're going to leave yourselves wide open. And I do like this picture because it does, I think, sum up consultation, participation, communication, collaboration. Everybody working together for a common goal. And it's not just health and safety, it's quality, it's environment, it's any other elements that you need to put in place to ensure you do the job correctly. We have lots of information on the authorities' websites in relation to safety reps. On BeSMART.ie, we have a section specifically tailored for the site safety representative. Now, it's based on all sectors, but you will go in there and find specific information. We also have an e-learning module, which is coming online, and I'll talk a little about that in a minute. The safety representative in taking care of business broken down into, information for employers, because they need to know why you need to have safety reps, and try and get them to buy in to the process is also very important. What the role of safety rep is, publications and documents that's useful for those people. We have a little poster there that you can put up in the canteen, just letting you know who is the site safety rep. How many people here, just as a straw poll, would have safety reps in their business? Okay, so we're bordering on 40-50%. It's good to see. It's something that we encourage, and we want to see more. Want to see more of it happening out there. And again, promoting it up there, letting people know who the site safety rep is, what to do if they have an issue, because they may not want to go to management to bring up the issue. So the safety representative is a key person as far as I'm concerned on the site. We have developed a checklist for safety reps, so if they want to go out and do a little audit of the site, there's a nice tailored checklist that will help them get around the site and bring up any issues that they can bring back to management. And a new feature that has come to hsalearning.ie is an online e-learning safety representatives course. It's about half an hour long, and it gives a nice little introduction to the role and what's involved in the role. It's free, like everything else that the HSA produces. It just takes a little bit of time and effort to make sure people know where to go and find it. So where you need to go, hsalearning.ie. Now, consultation, key factor in terms of the work that we do. In terms of BeSMART for construction, our BeSMART general safety statement. Step 3, highlighted there in green, is consult. And we need to make sure that when you are identifying hazards in the workplace, you are putting in control measures to reduce the risk from those hazards, that you communicate and talk to your workers and talk to your employees. Let them feed back into the process. Because as I said earlier, they sometimes have the appropriate answers. They are the ones who are actually doing the work, who are getting their hands dirty, and who probably can give you the best solution. So always listen to your workers. Consult with them, listen, communicate effectively. In terms of documentation that we produce, in terms of the safety statement and the construction stage health and safety plan, section 2.2 and 2.3 deal with consultation, participation, and the safety representative. And there's enough information there for anybody who's reading the document for the first time to actually let them be aware of what their requirements are under under Regulation 25 for the safety rep in the construction regulations. And as I say, broken down into 2 simple sections for people to read. Just going to diverge slightly a little away from the consultation and the safety reps, but I do think it does sit in here in terms of 45,001 in terms of safety management systems. We are updating the construction stage safety and health plan that we have available, which is a free template that contractors can use for projects where they have been appointed to PSCS. So when is it required? Obviously when there's more than one contractor, there's particular risks. Work is going to take longer than 30 days. You need to make appointments and you need to develop your construction stage plan. So you can do that using BeSMART. It is a template. And with any documentations that you do have and you do provide, you need to fill it out. And we are having experience of inspectors going out to sites and seeing the template just printed off and thrown in the corner. And that is the same for safety statements. So if you have the documentation out there, you need to make sure that whatever risk assessments that you have within the document, that you're applying the appropriate controls and that you're working to what's in the document. It is a live working document. You need to sign and action responsible persons, and that is the key feature to the plan as far as I'm concerned. Spread the load, spread the responsibilities. Make people responsible for things that they have to do and they have to action. And if it's not in the construction stage health and safety plan for BeSMART, look at your own systems and see how you can get people involved in carrying out specific tasks that requires responsible persons and competent people to make sure they're done effectively, smoothly. And that comes back into communications, talking to your employees. A name and a signature. It's always very good to focus the mind. So try and get people to understand what they have to do and then make them responsible. The PSCS business type, I hope to have it up later in the month. It will help with compliance in terms of the construction regulations of 16, 17, 19, records management. And the great thing about any of the stuff that we have available, even the e-learning, it's educational as well as work-related. You learn by doing. The business type will be available as a PSCS business type. It's a signal business type. At the moment, the plan is available to all construction business types when you complete a risk assessment using the safety statement tool and BeSMART. We'll be removing that option and just having one focused business type. There'll be 11 particular risk assessments developed along with 2 checklists. You'll also have access to the Browse Hazard database. You'll be able to manage your action list. And very importantly, NALA, simple English, in terms of the controls required for hazards that you will find on a site. And this comes back to communication, talking to your employees. Can they understand what's asked of them? There's no technical jargon. Simple English. And it's something, if you haven't done and you're looking at your workforce, maybe look at NALA principles in terms of writing documentation. We're not perfect either. There's things that we can improve on. But in terms of the hazards and the controls, that is NALA guidance, and it's written to those standards. And then you can download your documentation in a PDF and an RTF, and you can amend it, update it, because it is a live working document. So assign actions, develop and review on a constant basis. 4-step process: project information, project management records, and assessment and action lists. And again, we give detailed information how to use it and how to fill out the plan. We give step 1 in terms of project information. You put all the useful information in there. Project management, 214 covers safety consultation and site safety representative. It is part and parcel of everything we do and we develop is to make sure consultation, participation, safety reps are involved in the process. Good records management. Another area, another failing that I had seen over the years was, not having adequate records, training records in particular, statutory inspections. That information should be clearly available. And if you have a good management system, whether it's 45,001, safety cert, it will give you that structure, that framework to make sure records are managed. Particular risk assessments, as I covered, there's 11 of those that will go into the system. And 2 checklists. One is a mandatory checklist. It's similar to the one that's in the SSWPs, and then a welfare checklist. And I say welfare is one of the big issues that we will be looking at, along with timber frame housing, health in terms of, as I mentioned, silicosis, asbestos, construction dust in general on site. I'm not going to talk too much more because I think I've covered it, but good records management, good structure, good safety management system will help you to do that. It's just making sure responsible persons carry out that activity and make sure the records are kept and managed. Supports for the safety reps and for yourselves, not just safety reps, go to the HSA website. We have a workplace contact unit, 11890 289 389, or by email, wcu@hsa.ie. And if you have a query or you have a complaint, you can put it in through those numbers. We have BeSMART, which is a dedicated website, which allow you to do your safety statement and construction stage plan. And likewise, we have publications and guidance and e-learning sections for site safety reps and anybody else. For your information, we have developed 4 short videos. They're all around 2 minutes long, some a little bit shorter. One on the role of the client, one on the construction stage plan, the project supervisor construction stage, and the role of the PSDP, or project supervisor design process. They're available on BeSMART or on the HSA construction pages. And they're quite useful, just to give you an overview and a flavour of what is required of each of those roles or requirements in terms of the construction stage plan. And we have 2 further videos under development, one on the site safety representatives in the workplace, which we hope to have available shortly, and one for the duties of general contractors in construction. So I think, nice information there. If you're dealing with somebody who needs an overview, you can push them towards those videos. So my top tips today, and just to finish off, consult, listen, and communicate. And listen to all people. People do bring value to the work, to the job, to the activity. They can bring value. And as I say, if you work well as a team, the job will work well, will come in well also. Resource, implement, and review. Okay? Very, very important. Have we got the resources? Can we implement what we've planned? And to make sure we review it and make sure we learn from our mistakes. Assign responsible persons, and that is a big focus. Let people take responsibility for various actions on site. Within your framework, your safety management system, 45,001, you need to assign people who will take responsibility. Coordinate and ensure contractors are doing what they say they're doing. No point having a safety statement handed into the office, you go down the site and they're doing exactly the opposite. And we are seeing a lot of that out there. So if you are operating as a PSCS on site, you need to manage and coordinate and make sure your contractors are doing what they're saying they're doing. Always strive for continuous improvement. And that is the key foundation of 18,001, 45,001. Continuous improvement. Keep good records. Keep good records. I can't emphasize how important that is. So to conclude, our aim at the end of the day is try and give as much information out there as possible to the industry, to the sector, to try and prevent accidents happening in the first place. We want the numbers down. We don't want people going into hospital. I don't want to be going out to a fatal accident on a construction site. And I've been to enough of them. And it's not a good place to be. So we need to manage. We need to communicate. We need to resource. And we need to do our job safely. Sit back, reflect, review. At the end of a project, what can we do better? And then apply it into your safety management system, whatever it is. Thank you very much.